register. And then pastikan you masuk entrance exit entrance form. Dalam segala maklumat saya akan sampaikan melalui U-Future, material, nota dan sebagainya. Akan masuk kepada U-Future. So untuk hari ini semua sedia maklum bahawa kelas kita adakan pukul 2 petang. 2 petang hari Senin. Pukul 2 petang. So harap semua dapat join lah. At the same time, I will record segala kita punya syarahan ni, and then you all boleh semak balik apa yang dah direkod dan sebagainya. So OCT 530 intervention, OT intervention in psychiatric. So this subject is a 2 credit subject. So, untuk assessment, Dr. Zamir, untuk intervention saya lah. Jadi ada 47 orang, semua dah masuk dalam online. And then kalau ada sesuatu yang tiba-tiba terkeluar tu, you just remind me lah. Remind me. So untuk subjek ni, kalau kita tengok syllabus, saya akan sharekan syllabus dia sekejap lagi. Okey, syllabus dia kalau you ambil dalam AIMS, dalam AIMS. Kalau you download dalam AIMS, ini dia punya sinopsis. Course learning outcome, CLO dia. So in the subject, in this code, you going to understand models and intervention, OT in psychiatric condition. What the difference between diploma and degree is that you are well versed with the evidence, and you are more knowledgeable in terms of literature, appraisal of the evidence. So this is the difference between diploma and degree. So saya nak admit, ada 50 pula ya. Selamat datang ni 5 orang lagi. So dah 50 orang, 50 participant dalam grup ni. So the second course learning outcome is to, if you are able to determine OT intervention. So for dalam psychiatry intervention ni, you need to be able to determine what intervention that's suitable for different conditions. This is very important. So that's why before this class, you all have to understand the condition first. The condition first. So I have to mute you so that tak ada dengar bunyi burung dan sebagainya. Mana yang nak mute you? See? Then the third one for the CLO, for you to display OT intervention skills in specific psychiatric conditions. So in this subject, in this course, you need a skill. skills when talk about OT intervention in psychiatry. Some of you need to do, for example, skills. For example, interventions like therapeutic interventions or that. So you must have a skill not only to administer the intervention, but also to manage the outcome of the intervention. So in this course, when you read this course, that the subject introduced students to OT practicing psychosocial rehab, mental health and developmental disability in adolescent and adulthood. So this course focus on adolescent and adulthood. So this course aims to develop skill, knowledge, and attitude in selected treatment principle, technique, and activity to address the deficit of delay in occupational performance. So occupational intervention in the treatment of client with psychosocial dysfunction associated with psychiatric disorder of childhood, adolescent, adulthood, and old age. The topic deals with specific approach that drawn from range of models, including preventive role of OT in traditional and non-traditional mental health setting, current and future. So you need focus around problem-based learning, method of inquiry. So in this course, I will complement the topic with the problem-based learning. But in OT, it's more on case scenario based learning. So what are the intervention? And the intervention can be cognitive, psychosocial, physical, exercise dan sebagainya. And also and then they have also stress management, social skill training, group therapy, reality orientation, reminiscent therapy. So anyone knows about reminiscent therapy? Reminiscent therapy talking about reminding the situation yang dulu, yang lampau. So this is they call it reminiscent therapy and also behavior modification. So a lot of your cases in relation to psychiatric disorders, they have behavioral problem, behavioral issue, behavioral issue that some of them need to modify their behavior. Sure, if the behavior is normal, there's no problem. If the behavior is not normal, so you need to modify their behavior. This is due to the conditions and also the condition of the symptom of psychiatric disorders, and then at the same time the environment. For example, they're living in institutions, they all been institutionalized. Then there is a problem of behavior. So as an OT, we can play a role in terms of doing behavior modification for them. So this is the description of the course. And then when you look at the content of the course, this one, OT in psychiatric setting, impact of mental illness, performance area, the frame of reference, OT intervention psychiatric setting, so all will be in these courses. Then there is an individual therapy and therapeutic group.
Parah.
Kenapa? Ada yang tak masuk lagi? Ada yang terkeluar ini kadang internet problem. Kalau siapa yang pakai Unify, tak ada masalah lah. Yang pasal pakai mobile data ni kan there is an issue. But no worries, siapa yang cannot enter in this session, that's why I record this session. So this is the thing. So because of this COVID nature, the COVID-19 phenomena, you all not to dia punya method be different. Different. For example, like right now there is no final exam. So all method of assessment is involved of continuous assessment. Continuous assessment. I will provide you with the scheme of work. Scheme of work that you can follow what we're going to do in terms of weeks. In terms of weeks, I will highlight to you all. Okay. Okay, I'll show you the scheme of work. Okay, this is the scheme of work for this OCT 530. I already put in 14 weeks. In 14 weeks, what we're going to do, and you all know that you've been divided into 3 groups, kan? Group A, B, C. Group A, B, C. There is a timetable for Group A, if I'm not mistaken. Group A, the timetable is that sekejap ya. Okay, timetable. In the timetable, you see that there's a lab. There's a lab for every week. For example, OCT Group C 530 will be on Tuesday, 8 to 10. 8:30 to 10:30. Betul tak? Kelas? Semua senyap je? Kenapa? Okay semua?
Betul.
Okay. Will be 2:30 to 4:30. And Group C will be Group D will be on Friday. Friday 2:30. You all divided into 4 groups. 4 groups. Tuesday 8:30 to 10:30. And then 2:30 to 4:30, Group B. They want Group C, morning, Group C. Then on Wednesday, Group A. And then on Friday will be 2:30 to 4:30, Group D. But lab ni, usually I don't like it on morning lah. Betul tak, kelas? Hello? Macam mana semua? Yang Group C ni boleh tukar ke? Hello?
Tukar ke hari apa tu?
Hari apa yang you free Sebelah petang tak boleh? Sebelah petang on Thursday 2:30 to 4:30. Can lah?
yang
Ah.
based on our timetable, kita orang tengok pagi Selasa pukul 8.30
Pagi Selasa kan? 8.30, 10.30 gitu grup C kan? Boleh tak kita tukar kepada petang ke?
petang hari Selasa atau hari Khamis.
Hari Khamis? Boleh tak? Hari Khamis boleh petang?
Yang
Selasa pun free ke?
Selasa ada grup lain.
Oh, ada grup
B.
lain.
Khamis?
Khamis
Khamis petang?
Khamis
Khamis
boleh.
Khamis petang grup C tau. Boleh?
Okey.
okay.
Boleh?
So tukar kat situ 2.30 hingga 4.30. Lab kita buat petang lah. Kan? Boleh semua? Boleh.
Boleh.
So you tengok sini dalam scheme of work. First week introduction OT in mental health and wellness. Then second week will be role of OT in management client with physical dysfunction. And then we're talking about theoretical model and frame of reference in psychosocial rehab and evidence-based study. So when talk about evidence-based study, what is it? And then third week will be goal setting and treatment planning and also activity analysis. This is very important in terms of OT intervention. How we set our goal and how we plan with the patients. Then how we analyze the activity. Then fourth week, behavior management strategies. This is also very important because in your setting, you're going to face different conditions with different sort of behavior. Some of the behavior, very aggressive behavior. How to manage that? Some of your patients, they're doing funny things, kan? How to manage that? And then mental health, physical activity. So this is called enabling participation. So in mental, in terms of intervention, our intervention is very good. Is very important. We have physical activity, physical activity. So how we going to design our intervention based on physical activity? Then client-centered group, more on group dynamic activity. Then we have creative activities. Then we have semester break. I don't know how semester break when, but I just put there. If the thing fall on the 8th week, we have a semester break on the 8th week. Then therapeutic play. Then lab social and skill training. And then cognition and cognitive approach and realization training. Then OT intervention in different settings like hospital-based, community, institutions. So what are OT intervention in that setting? Then I will provide problem-based learning. It's more on case management. So in this week, I will give a case scenario, and then you are going to give opinion, discussion. So what we're going to do in this case. And so this is very important, kan? When you do practical, you got case, for example, case schizophrenia. So this case, in terms of history, in terms of family. So as an OT, what you going to do? So this is more on PBL, case management. And then actually there's no final exam. There's no final exam here. So this one need to block lah. No final exam here. So our method of assessment are more on continuous assessment. So it'll be assignment 30%, lab project 40%, then there'll be test 1 50% and test 2. So all together 100%. So the test 1 will be on the until at the probably at the 4th week. Then test 2 will be at the 11th week. So because there's a lot of complaint from you all, not you all lah, other students, they don't want so many tests. So we need to instruct all the lecturers don't have many tests. Test for you all. So only 2 tests. The test will be online. Online. Then there is assignment. So I will give you the assignment. Probably I'm going to do probably assignment in terms of writing. And then lab project. So lab project more on group project. Group project. For example, we're going to have a physical activity. So, for example, you come up with group of 6 or 5 person in one group. So you design activity, physical activity that involve physical activity, the administration, the value of this physical activity. I will give you the guideline to you all.
Doktor,
Okay, ya. Siapa tu?
ada pelajar Husna.
Husna, ya Husna.
Ada pelajar nama Alin, dia nak masuk tapi doktor kena allow-kan.
Okay.
Ha.
Okay, admin Aileen,
Alin.
Aileen Aina. Okay, Aina, welcome to the group. Itulah. This is the internet problem. Probably Aina using mobile punya internet. Aina? Hello Aina.
Hello.
Aina ya?
Ya.
Kenapa keluar tadi Aina?
Internet problem. Sini hujan.
Okay. Okay. So you all remind me kalau siapa yang terkeluar tu nak masukkan. At the same time I record lah. I record today punya session. So I summarize the thing in our work scheme. There's no final exam. There will be continuous assessment with assignment 30%, lab project 40%, test 1 50% will be administered at probably at the 5th or 4th week, and then test 2 will be at 11 weeks. So you got any question about this thing? This scheme of work? Anyone? All happy?
Happy, sir.
Happy, okay. So all happy. All right. So for today, introduction. Introduction. So if there is no question, I stop sharing this scheme of work. So for today, it will be only introduction, OT in psychiatry. Okay, sekejap ya keluar. Alright, sekejap Okey, semua nampak apa PowerPoint?
Nampak.
Jelas.
Jelas okey. So this introduction for today, introduction of OT in mental health and wellness. By the end of this lecture, you are able to understand the learning outcome of the course. I dah terangkan learning outcome specific for OT intervention in psychiatry. And at the same time, you as a degree student, you are able to appraise evidence regarding our intervention, evidence-based practice. So in medical, evidence-based practice is very important. Without evidence, so you need to rank your evidence. For example, like medical doctor, their evidence is the grade A evidence, more on randomized clinical trial. For example, like this COVID-19 vaccine, they won't allow the treatment unless the evidence involve a randomized clinical trial. They buat trial, they randomly, they test with the placebo yang tak makan, yang tak guna vaksin tu. So, they assess dia punya outcome, then they decide. This is the evidence. Like OT, because our development not so kita punya knowledge pun tak berapa banyak, so kita punya ranking will be lower in terms of evidence-based practice. But we should know and we should understand how the evidence being appraised. And then understand the assessment involved the course. I already told you. We don't have any final exam, only continuous assessment. Then in this topic, understand the history of OT in mental health. You all have to know the history of OT in mental health. Actually, OT in mental health is quite synonym, and they call it synonym. Whereas there is mental health institution, there is an OT. Our profession actually being recognized and known in psychiatric setting, in mental health. So, and then define OT roles in mental health in the context of World Health Organization and Malaysia Ministry of Health. So you need to understand your role in mental health in the context of WHO, World, and also in Malaysia under our Ministry of Health. So this syllabus schema outline have been informed just now. This one,
Doktor,
Yeah,
slide doktor tak jalan.
tak jalan.
Dekat first page lagi.
First page tadi. Ni,
Introduction lah. Tak
Okey
gerak
tak?
pun.
dah gerak dah?
Tak.
Tak, doktor.
Tak gerak? Ni,
Tak.
tak gerak?
Belum.
Tak gerak lagi doktor.
Belum gerak lagi? Okey.
Belum.
Apa ni? Kita stop share. Sekejap ya. Stop sharing and new share. Sekejap ya. Okey, nampak?
Nampak.
Nampak Okey. The earliest evidence of using occupation. The earliest evidence of using occupation as a method of therapy can be found in ancient times, in 100 before century, by Greek physician Asclepius. initiated human treatment of patients with mental illness using therapeutic baths, massage, exercise, and music. So before century, a Greek physician, they use the modality of therapeutic baths. Therapeutic baths ni maksud apa? Mandi bunga. Kalau kita mandi bunga kan, dia mandi air panas ke, mandi minyak ke kan, untuk treat mental illness. Massage and exercise and music also. Ni before century. Later, the Roman Celsus prescribed music, travel, conversation, and exercise to his patient. So Celsus, Roman, then later prescribed music, dengar music, travel, conversation. Conversation maksudnya individual discussion, motivation, advice ke, counseling ke kan. However, by medieval times, the concept of human treatment of people considered to be insane was rare, if not non-existent. So untuk biasanya kalau dulu, if dari insane people, orang yang ada mental ni, macam tempat kita jugalah, dia pasungkan saja, dia penjarakan dia, dia semua there's no treatment, ya. Okay. Nampak slide ni? Okay. In 19th century Europe, revolutionaries such as Philip Pinel and Johann Christian Reil reformed the hospital system. Instead of the use of metal chains and restraints, their institution utilized rigorous work and leisure activity in the late 18th century. Kurun ke-18, dulu dia punya sistem hospital, orang yang ada mental problem, dia insane, gila. They use metal chains and restraint. So, dia ikat. Dia guna gari. But dia reform dia punya sistem, dia guna work, rigorous work and leisure activities in the late 18th century. So this was the era of moral treatment. So they call it moral treatment. Developed in Europe during...
Slide tak gerak.
Tak gerak? Tiba mana? 18th century Europe kan?
Tak, bukan.
Habis?
Dekat illustrate evidence tadi yang waktu.
Okay,
Illustrate evidence.
saya guna ni terus lah. Kita terus. Nampak tak dia gerak?
Tak.
Nampak?
Tak.
Okay. Okay. This was the era of moral treatment developed in Europe. Europe ni, okay, ni dulu tadi, yang ni tadi. Ni dah. Ini guna travel. Ini. Dulu dia guna chains and restraint. Chains ni guna rantai, besi, ada gari kan. Guna diikat. Tapi kemudian, dia reform, dia buat rigorous work and leisure activity at the late century, 18th century. This was the era of moral treatment developed in Europe during the era of Enlightenment, where the roots of OT lie. So kalau you nak tahu apa sebenarnya OT punya root, di sinilah. Dulu,
Doktor,
ya,
slide tak gerak lagi.
tak gerak lagi. Betul lah slide. Okey. Okey, saya
boleh share slide tak dengan kita orang?
apa ni?
Share slide dekat WhatsApp.
Oh,
Supaya kita orang boleh tengok sendiri. Sebab dia tak gerak.
tak gerak Okey, saya cuba sekali lagi. Saya cuba sekali lagi.
Okey.
Okey. Okey. Nampak?
Nampak?
Ini yang nombor 5 ni, slide yang kelima. 5 daripada 3. Nampak Nampak tak?
Nampak.
So, kalau you nak tahu asal usul OT ni, ni zaman ni, zaman moral treatment. Moral treatment is the root of OT. Zaman yang dikata guna leisure, aktiviti guna pekerjaan work, kan? This one, they call it moral treatment. Inilah asal usul OT. They call it age of enlightenment. So dulu, zaman dulu, dia buat guna gari, diikat. Kemudian Philip Panel, Johann Christian Rell ni, dia reform. Dia buat aktiviti leisure. They call it moral treatment. So this is the root of OT. Bermulanya OT di Europe. Although it was thriving abroad, interest in the reform of movement waxed and waned in the United States throughout the 19th century. It re-emerged in the early decades of the 20th century as OT. So daripada sinilah asal usulnya. Walaupun benda ni dibawa ke US pada kurun ke-19, tapi yang sebenarnya yang daripada kurun 19 ni re-emerge balik pada 20th century as OT. Ni dikenali sebagai OT. So kita punya asal OT ni daripada Europe. Kemudian pergi ke Amerika 19th century. Kemudian daripada situlah at 20th century known as OT, occupational therapy. Okey, slide ke-6 nampak? Nampak tak?
Nampak.
Nampak.
Okay. So 1860 and 1910, the arts and craft movement that flourished between 1860 and 1910 also impacted occupational therapy. So dalam between 1860 and 1910, arts and craft. Kalau kita tengok art and craft ni, kita buat treatment untuk sakit mental, inilah permulaannya yang memberi kesan yang besar pada OT, membuat rawatan. OT, profession OT membuat rawatan menggunakan arts and craft, kerja tangan. Art ni melukis dan juga kerja tangan. Kita punya asal rawatan dulu guna craft dan juga kerja tangan. In recently industrialized society, the arts and craft society emerged against the monotony and lost autonomy of factory work. So sekarang ni dah berbeza. Sekarang kita negara membangun banyak industri melukis dan juga kerja craft tangan ni dah tak banyak digunakan untuk merawat pesakit mental. Kalau you pergi hospital pemain pun dah tak banyak dah yang buat arts craft tangan. Art and craft were utilized as a way of promoting learning through doing and provided an outlet of creative energy and a way of avoiding the boredom that was associated with long hospital stay, both mental illness and for tuberculosis. So at the beginning, kita buat arts ni untuk memenuhi masa lapang. Memenuhi masa lapang, arts and craft tangan ni. Dan juga sebagai outlet kita punya creativity. Kita kan dalam setiap manusia ni ada creativity yang tersimpan, bakat terpendam kan. Dia akan channelkan bakat terpendam tu untuk mengelakkan boring tu menggunakan arts and crafts. Okay, kita jumpa lagi slide ke-7. So the health profession of OT was conceived in the early 1910s as a reflection of the progressive era. Early professional merged highly valued ideal such as having strong work ethic and the importance of crafting with one's own hand with scientific and medical principle. So dalam era 1910 ni barulah barulah ada reflection tentang the value buat kerja tangan ni. So bila dia buat kerja tangan ni, dia menilai secara saintifik bila buat tangan ni apa therapeutic value, apa improvement yang dapat dibuat. So lagi dulu memenuhi masa lapang, sekarang ni lebih kepada scientific approach. Value dia apa kalau buat ni, dapatkah improve dia punya concentration, dia punya reduce dia punya positive symptom, dan sebagainya. From that, there is a National Society for the Promotion of Occupational Therapy, now called the American OT Association. Now from that, dia ada tubuhkan satu persatuan, they call it American OT Association. Dia nak promotekan terapi gunakan occupation. So there is an Occupational Therapy Association was founded in 1917 and the profession of OT was officially named in 1920. So kita punya profession officially named in 1920. So sekarang ni tahun berapa dah? Tahun 2020. Dah berapa tahun? Dah berapa tahun OT wujud? Dah 100 tahun dah. Kan? Betul tak?
Betul.
Tu kita kena rayakan. 2020 is the 100 years of kewujudan OT. OT, gelaran occupational therapy, treatment, they call it occupational therapy. Occupational therapist bermula 1920. Itulah officially named. Dulu dia orang tak tahu kan guna craft ni untuk penuhkan masa lapang. 1910 barulah ada kajian saintifik. Kemudian 1920 barulah nama dia terbentuk OT. So 2020 ini kita dah 100 tahun. Kalau orang tanya, patut you all buat sambutan 100 years of OT exist. So, kita dah 100 tahun. So in World War I, so dalam World War I, banyak orang yang cedera kan, wartime injuries. They call OT ni, they call it reconstruction aids. Reconstruction aids. Ini dikenali sebagai OT aids and physiotherapy aids. Known as physical therapist. Dulu kita pun tak berapa dikenali. Masih kenal sebagai physical therapist. Dia panggil apa, OT aids, pembantu. They call it reconstruction aids. So between 1917 and 1920, nearly 148,000 wounded men were placed in hospital upon their return to state. So di sinilah they call it reconstruction aid ni, buat apa ni, terapi kat diorang. Dia ada macam-macam penyakit lah, post traumatic disorder, amputation, cedera, hilang kaki dan sebagainya. Di sinilah reconstruction aids, largely made of women. Women paling ramai lah. Sampai sekarang pun dalam kelas you, berapa sangat lelaki. So you all majority, women is the majority. Post-war, however, there was a struggle to keep people in the profession. Emphasis shifted from altruistic wartime mentality to the financial, professional and personal satisfaction that comes with being a therapist. So benda ni tak lama orang jadi OT sebab habis kemala apa ni, peperangan, orang tak nak jadi OT dah sebab dah tak ada orang injured dan sebagainya. To make the profession more appealing, practice was standardized as was the curriculum. So untuk tambahkan minat orang dalam profession OT, dia buat standardized practice. Itu sebab standardized practice ni contoh macam apa? Kita ada OT framework kan? Model of practice, MOHO, Canadian, all these things to make the profession appealing. Entry and exit criteria were established and the American OT Association advocated for steady employment. So, bila orang nak masuk dalam profession, the best thing is that boleh bekerja lah. Kalau tak boleh bekerja, tak ada orang kenal OT, macam mana kita nak belajar OT? Contoh sekarang, dulu pada masa saya belajar dulu, tak ramai orang kenal OT. So nak dapat kerja susah. Yang dapat kerja di jabatan kerajaan, di hospital dan sebagainya. Sekarang orang dah kenal dah OT. This is, you have to recognize you punya senior, you punya association, you punya senior-senior yang promote OT. And that's why right now parents aware OT itu wujud. Kan? Sekarang parents willing to pay anak dia punya fees untuk masuk OT. Kalau sekali masuk dapat RM60, RM80, okay, you all semua kalau ada yang graduate sekarang, semua dah ada klinik masing-masing. This is the, you kena admire and then respect your seniors. Because of them, they are the parents and the community, our people, our nation recognize OT. This is very important. So, you tengok OT therapy, occupational therapy, toy making in psychiatric hospital. So, di dalam hospital ni, OT buat toys. Dalam hotel itu adalah role play, ada aktiviti lakonan dan sebagainya. Because some of them kalau you pergi war kan, berperangan, some of them ada traumatic, psychosocial problem, post-traumatic disorder, stress, grief, depression dan sebagainya. So this is the thing they do. They're making a toy. Making a toy is one of the occupation tasks. OT during World War I, bedridden, wounded are knitting. So, bayangkan kalau you cedera, tak boleh buat apa, tak boleh bergerak. So this OT buat knitting. Knitting tahu apa dia? Menjahit, menyulam. Dia buat dekat pesakit yang tak boleh bergerak di atas katil. Dia buat apa? Knitting. Buat baju sejuk kan? Dan sebagainya. Ni World War I. World War II, influenced by criticism from medicine and the multitude of physical disability result from World War II, OT adopted a more reductionistic philosophy for a time. While the approach led to development in technical knowledge about occupational performance, clinicians became increasingly disillusioned and reconsidered this belief. As a result, client-centeredness and occupation have re-emerged as dominant themes in the profession. Over the past century, the underlying philosophy of OT has evolved from being a diversion from illness to treatment to enable through meaningful occupation This became evident through the development of widespread adoption of Canadian model of occupational performance. So World War II, kita punya approach lain. Sebab physical disability World War II makin mencabar, makin banyak. So dia approach dia berbeza. Dia lebih kepada client centeredness and occupationally immersed. So philosophy OT has involved being a diversion from illness. So kita bukan saja OT sebagai diversion therapy. Sekarang jangan sebut diversion therapy. Kita nak diversion apa maksudnya? Diversion ni kita nak occupied dia punya time. Bukan lagi occupied dia punya time, tapi kita buat sebagai treatment. Treatment, we enable them through meaningful occupation. This became evident through the development and widespread adoption of Canadian model of occupational performance. So last time we only involve of diversion, occupied their time. But right now we do a treatment through meaningful occupation. Ini wujudnya dalam World War II, wujudnya Canadian Model of Occupational Performance. So this daripada World War I, World War II, kita makin meningkat profession. Ini Indonesia macam mana pula? You kena sejarah history of OT therapist di Malaysia. Mungkin introduction dia dah ada, kita nak reflect balik. So siapa yang OT pertama di Malaysia ni? Anyone? OT yang pertama di Malaysia ni from Australia, Barbara. Mrs. Barbara ni, dia qualified OT from UK. Tapi dia kerja pada tahun 1958 dekat Leprosy Center at Sungai Buloh. Mrs. Barbara Thompson saya ingat. British citizen. Kemudian, ni. Lepas Barbara, Mrs. Aisyah Hashim. Graduate from University in Melbourne, Australia. She was the first qualified Malaysian OT. Since the year 1960, Puan Aisyah Hashim replaced Barbara. This is the first OT. Is a lady. She's a lady. Graduate from University in Melbourne, Australia. So the first area that OT do work is at Leprosy Center. Leprosy Center sakit apa dia? Tuberculosis. So in terms of psychiatric di mana? Kita the first psychiatry where OT work is at Hospital Bahagia Ulu Kinta, Perak. Psychiatric Hospital is the first OT work at Hospital Bahagia Ulu Kinta. And then Hospital Tampoi, Johor, Psychiatric Hospital. Dan di situ pusat perubatan medical Universiti Melaya. Universiti sekarang ni pusat perubatan Universiti Melaya. Dan Hospital Penang. Saya pernah posting Permai, saya pernah pergi saya pernah kerja kat Permai, saya pernah posting dekat pusat perubatan Universiti Melaya, saya pernah posting dekat Hospital Penang. Ni saya pernah datang kat Hospital Melaka. Hospital Kuala Lumpur saya pernah posting sana, dan Hospital Ipoh. Inilah tempat-tempat yang bermulanya OT profession in term of psychiatry. So in term of establishing OT association, you see, since 1969 kita dah establish Malaysian OT Association. So you tengok sini, Barbara Aisyah 1960, dan juga in 1969 ni mungkin penubuhan Aisyah dengan jasa ni dan juga senior-senior yang lain. They establish Malaysian OT Association, and we become a full member of OT, WFOT in 1990, and our college, Kuala Sekutu, WFOT being recognized in 1992. WFOT have recognized our diploma program in KSKB. UITM, the first been recognized by WFOT in 2007. So when you all graduate as an OT, you being accepted throughout the world, in Australia, in UK, and because our degree has been recognized. The only thing you need to sit an exam, local exam over there. Ada soalan lagi? Yang lain ada apa-apa nak tanya? So, you dah kenal OT in psychiatric Semua dah tidur ke? Halo. Semua ada
Ada.
Okay. So, in world WHO, in terms of WHO perspective, WHO constitute that health is state of complete physical, mental, and social well-being. The necessity for mental health care to be integrated with the rest of the health program is beyond doubt. So, when talk about complete physical, mental health, social being, mental health care must be integrated. So, in terms of mental, WHO recognize mental health care must be integrated in the health program, under Ministry of Health. And whenever they develop curriculum or that, mental health care must be there, must be embedded. So activity related to mental health care whose ultimate goal is the improvement of the quality of life of the general population. So the ultimate goal in mental health is to improve in terms of their quality of life. So in terms of quality of life, there is a different perspective, in terms of quality of life, where WHO have come up with domain of quality of life. So what are the things that the population should do in terms of mental health care? They should promote mental health care. That's why kalau you tengok TV kan, dan sebagainya, ada promotion tentang mental health. And then prevention of mental and psychosocial disorder. Not only promote, we have to prevent prevention of mental and psychosocial disorder. And then the third target is to do rehabilitation of people with mental and psychological disorder. So we need to rehab whoever got this mental and psychosocial disorder. We have to do rehabilitation. And the fourth target is that we have to do psychosocial rehabilitation. So psychosocial rehabilitation is involved with the community. So like OT, if OT has treat patient, dia buat terapi, dia improve dia punya occupation, dia punya performance in terms of occupation, IDL dan sebagainya. At the end, that must be acceptance from the community. Parent dia mesti accept dia. Kalau tak accept, so the patient will be stranded at the institution. So we not only promote mental health, but also we do prevention. And then we do rehab, and then we do psychosocial rehabilitation. So 4 things. Goal of mental health care must be 4 things. So OT must involve in terms of promotion, prevention, rehabilitation, and involve at psychosocial rehab with the community. So definition of mental health is the capacity of the individual, the group, and the environment to interact with one another to promote subjective well-being and optimal functioning, and the use of cognitive, affective, and relational abilities towards the achievement of individual and collective goal consistent with justice. This is the definition of mental health in our National Mental Health Policy, Ministry of Health Malaysia. So mental health is the capacity of individual, the group, the environment. So we need to address the capacity of the individual. Together they can work or participate together in the group, and to the environment. Environment can be within the community, in workplace, in their house. Another to promote subjective well-being and optimal functioning. So we as an OT, we need to cater the individual and their parent, their spouse, and then their community, so that they can have optimal functioning, the use of cognitive, dia punya affective ability, relational ability, all these things. So mental health also deal with activities related to the development of functional, psychosocial, psychological skill and knowledge. Good mental health and well-being help prevent untoward consequence of social economic development and changes. So activities that functional psychosocial, maksudnya kalau you treat patient need to function at the community. Bukan setakat di balik rumah saja ataupun di institution, but also they able to function at the community. This is called psychosocial. Their psychological skill involve what? They able to tolerate frustration, they able to tolerate comment, they able to tolerate sarcastic, kan? Dia ada mechanism, kita kena bagi dia macam mana untuk coping skill, untuk function di community dan sebagainya. And then knowledge dia. So, in term of wellness, sekarang ni banyak tema-tema, kalau you tengok dalam TV, mental health and wellness. Mental health and wellness. What is it? Wellness. Is generally used to mean a healthy balance of the mind, body and spirit that result in an overall feeling of well-being. So your mind must be balanced, healthy balance of mind, body must be healthy, you punya spirit, semangat you, motivasi semua tu kena ambil kira. This is called wellness. Doesn't mean Ministry of Health address only mental health issue, but also the wellness. Wellness ni kategori normal people kan? Normal people.
Oh, tengah kelas lah.
Normal people. Dengar suara Ain ni. Ain dirit kat siapa Ain? Hello Ain. Ain ke siapa tadi? Ada kacau Ada siapa kacau?
Maaf doktor, adik saya kacau.
Cubit sikit adik tu Okay. Okay. So, not only addressing the mental health, but also mental problem, but also normal people. Normal people, they relate on wellness. Wellness. Healthy balance of the mind. Macam kita mesti healthy mind, kita mesti semangat mesti ada, kekuatan diri mesti ada. They call it wellness. Wellness also can be described as the constant, conscious pursuit of living life to its fullest potential. Kita mesti, when talk about wellness, kita normal people pun mesti ada constant, conscious pursuit of living life to its fullest. Kita mesti ada semangat, attitude untuk melalui kehidupan kita dengan cara yang terbaik, kan? Macam you sekarang ni ada isu COVID, kan? That's why kita kena maintain kita punya wellness. Constant, conscious pursuit of living life to its fullest potential. So that's why kalau sekarang ni, that's why kita tak temu muka pun tak apa. Tapi kita kena constant pursuit of our living life. Kita cuba yang terbaik untuk memberi pengajaran dan pembelajaran pada you all. So wellness can be described as a state that combines health and happiness. Those factors that contribute to be healthy and happy will also likely contribute to being well. So wellness is not necessarily wealth, kekayaan, bukan kekayaan. Kekayaan tidak boleh membeli wellness. Dia mesti kehidupan yang sihat dan gembira. Kita walaupun kadang-kadang kita tak kaya, miskin, tapi kita happy with our life. Tak ada monyok dan sebagainya, kan? Sebab we maintain our wellness. Wellness is combined health and happiness. Kita sihat, kita happy, dah tercapai actually hidup kita. Ada orang kaya, kan, banyak duit, tapi ada penyakit, kan, semangat dah tak ada, kehidupan, apa makna kehidupan? Duit banyak, tak gembira, tak wellness. So, wellness also being addressed by our Ministry of Health. You all tahu, OT is a healthcare profession based on the knowledge that purpose of activity can promote health and well-being in all aspects of daily life. Ini World of OT Federation. So OT believes in value of occupation, scientific, dan sebagainya. OT also can promote. Right now, from being hospital-based, OT move towards rehabilitation in the community. So, banyak OT yang sekarang ni kerja di klinik kesihatan, psychosocial rehabilitation. You all pun ada klinik sendiri di community dan sebagainya. OT respect the reality of life, real tasks of living and the individual mode of coping with daily tasks. It has been shown that OTs value occupation, that use a wide variety of treatment techniques and approach to establish healthy habits of healthcare and psychosocial well-being. OT is an important and integral part of the multidisciplinary team providing the therapy service in hospital and community setting. Function of OT therapy in HADAT, yang tadi, promotion, prevention, rehabilitation, and psychosocial rehabilitation. You all kena faham ni. When talk about function of OT, what is your role in adult psychiatry and mental health? This is the thing. You kalau di hospital, you kerja di hospital, di institution, you also do promotion. You pergi buat promotion kehidupan sihat, bagaimana untuk mencegah mendapat penyakit mental dan sebagainya, kan? You do prevention. Can be primary prevention, can be secondary prevention, can be tertiary prevention. Primary, apa dia? Secondary, apa dia? And then tertiary, dan apa dia? And then you have to do rehabilitation. This is our core business. Do rehabilitation. Educate application of functional, psychological, and psychosocial intervention aimed at reducing the impact of the disease. Psychosocial rehabilitation more on working with the community. You know, for example, when I working in Permai, I do a lot of psychosocial rehabilitation. I established halfway house. Halfway house is the transit house when they discharge from the hospital, institution, hospital Permai. So they stay at the halfway house. Over the halfway house, we find their job, integrate them to the community, and then after they independent, they go to their real house. They rent by themselves. They get married. They have family, dan sebagainya. So I do a lot of psycho rehab at the Hospital Permai. Okay, for this picture, what are these picture tu? Ada siapa boleh agak ni? Patient ni buat apa? Hello?
Buat pottery.
Buat pottery. Anyone?
Buat tembika.
Tembika. Clay making. So dia buat clay making. Ini you punya senior ni. Puan Siti Arbi ni. Puan Siti Arbi kalau tak silap saya umur dia dah 60 lebih dah. Dia kerja dulu di hospital Kuala Lumpur. Agaknya you all semua macam nenek you lah. Puan Siti Arbi ni. Dia buat clay making tu, dia buat pot. Dia letak dalam oven. Dia dapat clay. Dia buat clay ni, kemudian dia lukis, hasilkan produk clay daripada dia. So this is the occupation, meaning of occupation, kan? So ni semua dia punya outcome. These people dapat skill membuat clay making. The outcome is that patient able to sell this thing as dia punya livelihood. Dia dapat jual, dapat duit. Dia dapat release dia punya depression, dia punya tension, dia sublimate, dia channel dia punya depression, dia tension melalui melukis tu. Dia dapat hasilkan produk. So as a human being, kalau you dapat hasilkan produk, you will be satisfied. Betul tak? So this is one of the intervention, clay making. Clay making, there where the outcome is that ni semua ni kan, dapat improve dia punya livelihood, dapat skill untuk buat clay making macam mana, dapat channel dia punya depression, tension melalui melukis, dia dapat buat buas, tembika. Yang ini ADL skill. Ini ADL skill, activity of daily living skill. Salah satu activity of daily skill ialah memasak, membuat air, kan? So patient yang contoh kes yang ada masalah condition schizophrenia, dia ada issue of ADL, dia punya, kalau you tengok symptom and negative, positive symptom and negative symptom, dia become isolate. Dia tak nak buat apa-apa. Dia tak nak become dependent to others. So you want to improve dia punya independent. So task dia melibatkan buat air. So outcome dia apa? So you improve dia punya activity of daily living, dia punya skill of making coffee. Dia dah lupa dah nak buat air macam mana. Dia punya quality level dah down. Dia tak tahu macam mana nak buat kopi, teh. Dan you improve dia punya livelihood. Mungkin at the end, you dapat tempatkan dia bekerja di restoran, di kedai makan. Dia dapat duit, dia dapat bekerja. You dapat improve dia punya work habit dan sebagainya. Itu dah satu benda yang baik yang you buat. This one, leisure activities, dia buat apa ni? Hydroponic. So hydroponic popular untuk OT. Sebab apa? Dia ringkas, dia tak messy. At the same time, patient dapat tengok outcome dia. Dapat can see in real time dia punya hasil. Ada hasil gitu kan. Pokok membesar dengan warna hijau dan sebagainya. Dan dia pack, dia timbang, katakan setengah kilo, RM4. So dia pergi jual pada members of staff hospital. Staff hospital dia jual. So ni masa dia jual tu, you dapat improve dia punya apa? Dia punya communication skill. Communication skill. Macam ni nak communicate dengan orang. Kan? From example dia ada issue of depression. So depression dia become stupor, tak cakap dengan orang. So bila kita buat aktiviti jualan, dia dapat communicate. Dia dapat improve dia punya cognitive process, calculation, berapa tukar duit, dan sebagainya. I dekat Osteopermine, I remember at one time, I ada kebun rambutan. So I kutip rambutan tu, bawa ke Osteopermine. Satu bonet dalam kereta rambutan. Then saya latih patient tu macam mana nak ikat rambutan, timbang sekilo, katakan RM5. So dia tolak, turi 2-3 orang tolak, 2-1. So dia jual rambutan tu. Lala dia orang panggil apa, Sulaiman rambutan, OT rambutan. But that is objective of that kan. Kita nak improve dia punya communication skill, nak improve dia punya survival skill, kan, socialization skill dan sebagainya. Ini apa dia? Ya.
Boleh tak doktor admit balik Ain Hazika? Dia terleft tadi.
Okey. Ya. Ni Ain Hazika. Okey, Ain. Boleh masuk. Okey, Ain. Okey, dah masuk Ain? Halo Ain. Lambat lah Ain nak join Agak dia pakai mobile internet. Okey. Kalau Ain dah tu, Ain Hazika, dia ada banyak Ain kat sini. Zur Ain ada, Ain Hazika. Bila masa dia nak join ni Ain? Okey, tetapi saya rekodkan benda ni Joining. Okey, Ain.
Yes.
Okey. Ain terkeluar tadi Okey. Okey, you tengok sini, craft activity. Macam dekat zaman 18th century, craft activity is very good. It's very good. It's very productive. There is a outcome, hasil tu. Patient dapat tengok outcome dia. So, tengok craft tangan ni dia buat apa. Dia guna plastik ni, tudung saji ni kan. Dia buat bunga, dia buat cadar, dia buat tempat apa, isi apa ni? Isi apa ni macam-macam ada kat sini. Maybe one day kalau COVID dah reda, you all boleh datang sini, kita buat lawatan. Tempat orang admit all, social admit Okay. Ni craft activities. So Malaysia Mental Health Framework 2001 kita ada Mental Health Framework by Ministry of Health. Also they emphasize on the need for intersectorial collaboration and community participation is a necessity for mental health care. The goal of mental well-being cannot be achieved without participation from the community. So you need to have networking with the community agencies to be encouraged so that service can be expanded and extended to the community. When you work in mental health, you need to have collaboration with the community. Community must participate. For example, last time when I worked at Osterpermai, I got collaboration participation from the industry. For example, like Statler, Statler? Kalau you dulu primary school, sekolah rendah, you ada melukis kan? Guna color. Color ni salah satu pembekal ialah Statler. Statler ni cantik kan dia punya tu. Statler ni dia ada company dekat Permai sana, Tampoi sana. So company tu hantar kotak tu yang belum dibuat kotak. Dia print kotak tu sekeping-sekeping dan dia suruh dan saya plan dengan saya punya patient buat kotak tu. So dia buat kotak Statler lah. Daripada lepeh tu dia jantungkan, dia tegakkan jadi satu kotak. Dah penuh, katakan dapat 100, kita masuk dalam kotak dan kita hantar balik ke Statler. So sampai di kilang, dia akan terus masukkan pensel dalam. So kita ada collaboration dengan Statler and then di situ kita buat sheltered workshop. Sheltered workshop, patient datang kerja situ. Ada patient setengah yang patient ni tak boleh kerja competitive employment. Dia ada masalah behavior problem, dia ada masalah in term of physical dia tak boleh communicate dan sebagainya kan. So dia kerja di shelter workshop. So dia akan dapat upah, katakan 1000 kotak tu dia dapat dalam RM7. So kalau dia dapat 10,000, RM70 kan. So is a good thing for them because dia dapat gaji dan sebagainya. And then at the same time, Statler ni pun terima pesakit untuk bekerja sama. So I negotiate dengan dia orang. So I train patient tu in terms of the work behavior, good worker characteristic, dia punya attitude, dia punya control frustration, dia punya disiplin dan sebagainya. Selepas tu saya hantar kerja di Statler. So I negotiate dengan Statler, buat bayaran based on the days they working. That's better. That better in terms of kalau dia tak kerja, dia tak dapat gaji. Sometimes because patient, psychiatric patient ni, kadang-kadang dia ada punya graph dia. Kadang-kadang dia sampai masa dia default balik. Dia dapat symptom of dia punya condition, then they have to stay at the institutions. So dia buat kerja, ada kerja. Okay. Reference, buku yang saya suggest untuk baca ialah Jennifer Creek. You all belilah satu buku ataupun pinjam dekat library buku Jennifer Creek. Sekarang ni dia edition ke-6 edition ke-6 ke-5. This is a good book for you to read and understand OT in mental health. So, ada soalan tentang introduction ni? So, saya buka pada semua. Kalau ada apa-apa soalan, silakan. You all boleh unmute. Ataupun pasang video pun, saya nak tengoklah muka-muka seorang-seorang ni. Kalau you nak lah Okey Ain, ada soalan Ain? Ain dulu daripada mana? Bertam ke dulu? Ataupun student saya dulu Ain? Macam pernah nampak?
Doktor dulu.
Okey. Last semester saya ajar awak?
Masa SEM 2, SEM lepas.
Okey. Ada adik Okey.
Doktor, saya ada soalan.
Okey. Siapa ni? Siapa ni? Nama siapa?
Saya.
Siapa? Atira. Okey Atira.
Adira.
Video ni tak nampak muka Atira. Tunjukkan muka lah.
Saya alah malas nak pakai tudung lah doktor.
Okey. Atira pun nak tanya.
Kalau group assignment tu nanti doktor listkan group ke atau kita kena cari sendiri doktor?
You kena tubuhkan lah grup you.
Lepas tu ikut kelas ke atau tak payah?
Ikut kelas lah. Kan ada kelas A, grup A, B, C, D kan? So you divide among 5 to 6 person in one group. Tapi bagusnya 5 orang lah satu grup. Boleh? Tidak?
Okey doktor, thank you.
Okey, yang lain? Yang lain ada soalan? Apa-apa dia tanya je. You got no problem. I will answer you. Tanyalah apa-apa soalan yang nak tanya. Kalau tidak saya tanya soalan. Okay, anyone of you ada tak kenal jiran atau saudara mara atau keluarga yang ada isu of mental health, issue? Anyone? Fatihah? Ada. Siapa? Fatihah? Siapa tu?
Ain.
Ain. Okey, Ain. Okey, boleh cerita sikit.
Tak, mak saya yang cerita. Ada family saya mental health dia terbunuh seorang juga. Terbunuh.
Terbunuh? Dibunuh atau terbunuh?
Dia bunuh. Lepas tu bila check rupanya dia ada mental health.
So dia mungkin ada hallucination
Betul.
And then dia ada dengar suara untuk bunuh.
Dia cakap ada orang macam hasut dia untuk bunuh.
Dia ada paranoid syndrome kan.
Betul.
So dia mungkin kemungkinan dia kes jenayah tapi kod dia berbeza. Disebabkan mental dia yang dia bukan dia ada masalah mental. So dia jatuh hukum lah kan.
Betul.
Di hospital. Dia banyak, saya kerja dekat forensic ward dulu. Forensic ward ni kes-kes mental yang dia melakukan jenayah. Macam-macam tapi kita address that dia memang ada penyakit lah kan. Dia ada penyakit at that time, dia tak dapat rawatan. Bila sampai di hospital dia dapat rawatan, dia dapat buat rehab, dia dapat buat terapi. And then ramai di kalangan diorang ni, especially bila hari jadi sultan, dia dapat pengampunan. Yang paling mudah mengampunkan kes ni ialah daripada mana? Sultan mana? Agak-agak?
Sultan Pahang.
Pandai. Sultan Pahang. Memang bila macam mana tahu ni? Fatihah macam mana tahu? Dia ada
Tembak.
Sultan Pahang memang senang beri pengampunan. Ada satu kes tu dia bunuh bapak dia, pakcik dia. Sampai tu 3 orang. 3 orang dia bunuh. Tapi 5-6 tahun dia dapat pengampunan daripada. Memang dia at that time dia ada mental problem kan. Dia dah buat terapi, dia tunjukkan apa attitude, behavior dia dah pulih, recommendation daripada OT, daripada doktor pakar. Dia memang dah pulih, dia boleh kembali ke rumah dia dan sebagainya. So, yang penting bila kita dapat identify seorang tu ada masalah mental, dia kena dapatkan rawatan seberapa segera. Rawatan segera sebelum. So that's why prevention is better than cure kan. Kita kena prevent dia daripada makin teruk sampai membunuh. Itu dah 3 teruk lah. Okey, lagi siapa yang nak tanya? Siapa boleh share experience? Okay, anyone? Pernah tak nampak orang jalan, tepi jalan, jalan kaki, bawa badan, apa baju lusuh, kan? Tak pakai selipar. Pernah nampak itu?
Lalu.
That's why, kes kami itu, kalau community sedar, community try to help by assist the treatment to them, kan? Bawa dia ke hospital. Jangan sampai dia buat jenayah, barulah polis report, barulah polis bawa ke hospital ataupun penjarakan dulu, baru bicara dan sebagainya, dah tak guna dah. Dah terlambat dah. Belum terlambat lagi, boleh buat rehab, tapi dah apa kata orang, dah sampai peringkat yang lama lah untuk dia keluar daripada problem. Sekarang kes lagi masalah kes apa ni, COVID-19 ni. Kes COVID-19 ni banyak ada pilot yang terpaksa terjun peringkat 14. Sebab tak ada pendapatan, ramai pilot yang kena berhentikan. Berhenti kerja. Tempat kau terbang tak boleh naik ke udara sebab tak ada passenger. Banyak isu mental problem. Kejap lagi ramai yang depressed, bunuh diri. Ramai tak ada kerja, social problem, kan? Rumah tergadai, kereta kena tarik, dan macam-macam lah. Sebabkan COVID-19. So that's why kerajaan tak nak buat PKP. Kalau buat PKP, alamat lagilah teruk. Kalau student tak boleh buat online, kalau industri hotel dan sebagainya tak ada customer, nak bayar macam mana pekerja? Nak bayar hutang macam mana? So a lot of things will be, I think OT banyak akan diperlukan lagi dalam mental health and wellness ni. Lagi? Ada siapa nak tanya soalan lagi? Adik? Nur Adik?
Doktor, saya nak tanya.
Okey.
Saya Yasmin. Kan doktor cakap kita kena ajar balik, train balik ADL skills patient kan sebab dia lupa. Apa faktor yang patient tu boleh lupa ya? Macam efek ubat ke, ECT ke?
That's why you kena belajar condition. Contoh macam schizophrenia, kan? Dia ada positif dengan negatif symptom, kan? Negative symptom, evolution. Evolution maksudnya dia tak ada semangat, dia tak ada motivasi diri, kan? Evolution, motivation. So orang macam ini dia tak ada semangat dah, nak mandi pun tak nak gosok gigi pun tak nak, kan? Lagi kalau keluarga yang tak ada support from keluarga. So dia become isolated. the withdraw. Ada simptom yang withdrawal. Tahu withdrawal? Withdraw, duduk sendiri. Biasa dia kalau depression, dia withdrawal symptom. This what happen because of the condition lah. Condition dia. Dia tak nak, dia tak ada semangat dan sebagainya. That's why makan dah tak kisah. Pakai baju pun sembrono, tak pakai pun, tak basuh pun tak apa. This not because this due to dia punya condition. Kena faham ni, that's why kita study condition kan. Contoh kes apa yang kes withdrawal. Yang withdrawal, isolate herself or himself. Apa dia? Contoh macam kes yang ada depression, yang ada schizophrenia, yang kes contoh macam apa lagi? Kalau bipolar ni lain pula kan. Bipolar yang energetik dan cakap banyak. So that's why you need to understand whenever you terima pesakit, you need to understand dia punya condition tu. And then not only the person, not only the patient, but also dia punya environment dia. Environment dia duduk tu macam mana. Adakah parents dia tu faham? Adakah parent dia tu supportive? Kan? Spouse ni faham, supportive atau tidak. So semua tu kena tengok. And then not only the person but also dia punya quality. Probably dia ada traumatic brain injuries dan sebagainya. So ini need to understand. Kerana dia ada masalah proses of proses of sequencing kan. Dia tak boleh dah proses. Dia punya proses, contoh dia punya orientation, skill, dah tak ada dan sebagainya. So kita kena faham condition pesakit tu. Okay, good question. Lagi? Siapa yang tanya tadi? Yang lain? Ada yang nak tanya tak? Ada soalan? Hakim? Mana Hakim?
Dok,
Ya.
nak tanya tanda kedatangan kat mana sebab kat e-future
Tak boleh?
dah tak available.
Tak available. Okay. Hakim buatkan Hakim? Boleh? Buatkan apa dalam Google Form tu. Saya terlupa nak buat. Nanti you hantar kat WhatsApp ni. Semua register lah untuk hari ni. Ya?
Okay.
Okay, very good. Hakim remind me the attendance. Lagi ada siapa nak tanya? Tentang method of assessment apa semua? So dalam lab nanti, you in group, you design apa ni intervention tu. Nanti saya ada bagi format dia. So kita akan use buat design and then you present dalam apa ni group punya tu, together we present. Yang kita dengar, and then on that nanti I bagi terus mark kat you. So this is a continuous assessment, tak ada final exam. And mungkin practical exam pun kita tak boleh buat. Sekarang ni COVID makin tambah. Bayangkan kalau 400 setiap hari. Kalau 30 hari dah apa-apa dah. Letak mana pesakit? Katil dah tak ada dah. So kita nak kurangkan jangkitan ni. Sebab kita buat ODL. Online distance learning. So I hope you all be well lah. Kadang-kadang ada orang depressed juga duduk dekat rumah ni kan. Duduk kat rumah. Gangguan adik. Internet problem. Then sometimes you terpaksa tolong parents. Kan? Macam saya dulu pun. Saya terpaksa tolong parent saya. Pasal parent berniaga, bantu dia orang. So, cuma you kena manage your time. The same time, manage your time. Okay, ada soalan lain? Fatin? Juliana? Juliana Ibrahim?
Ya, doktor.
Ada soalan?
Tak ada.
Ada. Syaira Jamal. Mana Syaira Jamal? Ada soalan Syaira?
Ada.
Tak
ada, doktor.
Sarah Fatihah? Pun tak ada. Azika Izzati. Ramai ni, 47 orang ni pelajar saya ni. Azika Izzati? Tak ada?
Tak ada.
Alin Aina. Natasha? Nama sedap ni Natasha, mata orang putih pula nama ni. Natasha. So ada soalan Natasha?
Tak ada, doktor.
Tak ada. Okay. So this is the introduction for you all. So next week, the same time, and then the same time, I will upload you material for you to read. Sekejap Okay, kita yang lecture ni dah habis. So dalam YouFuture, saya akan letak folder apa ni? Folder saya folder saya. So jangan buka apa ni folder Dr. Fatma, sebab sekarang ni saya yang mengajar you all. Buka folder saya. Week pertama saya akan uploadkan material. Next week saya akan tanya soalan. Saya akan bagi contoh Ain, can you explain this topic? Ain kena respon Boleh? Saya akan bagi upload dah sekejap lagi material untuk you baca, buat homework sikit. Okay, kalau tak ada soalan, saya sampai kat sini je lah. Ya? Okay. Ada apa-apa lagi? Tak ada ya? Kalau tak ada, sampai sini. Stay home, stay safe. Okay. Make yourself happy. Become a wellness person. Okay, bye. Okay, goodbye everyone.
Thank you,
Thank you,
doktor.
doktor.
Thank you, doktor.
Doktor.
Thank you,
Thank you,
doktor.
doktor.